Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Recent advances actually, treatment of MI. So, whenever there is ST segment elevated MI, we can give first, we should have to give the patient thrombolytic therapy. Thrombolytic therapy is given with the help of the drug like streptokinase or urokinase, or we can use altiplase, streptokinase, urokinase, altiplase, or tinacteplase. One of the drug is selected based on the patient profile and side effect profile, and it is used in ST segment elevated MI for thrombolytic therapy. Then this should be started at least within 3 hours. Then morphine is given. This morphine will mainly is given to reduce the pain and to reduce the anxiety. That is, morphine reduces the sympathetic activity and thus it reduces the anxiety. Then we can also give low dose of aspirin is given mainly for its antiplatelet activity. We give low dose of aspirin. Then beta blockers are actually metoprolol. These metoprolol are the beta blockers which will these metoprolol will mainly decrease the infarct size, and they will also decrease the arrhythmias. They will decrease the infarct size and decrease arrhythmias, and thus they can be used. These beta blockers can be used in MI. Then we can also use oral anticoagulants can be used, and these oral anticoagulant will prevent the thrombosis. Then we can also use statins. These statins will mainly decrease the dyslipidemia, and statins can be used. And these are the drugs which can be used in ST segment elevated MI.
thank you and thank you for watching.